The clinical example, number 6, the energy treatment of musculoskeletal pain. A woman aged 54 came to me with pains in nearly every joint of the body. The pain started 2 to 3 months ago. All the pains were worst in the early hours of the morning, and she felt so uncomfortable in the bed that she had to get up. When she did, she was stiff everywhere, could not bend or move her neck, her feet were too stiff to walk properly, and her fingers had no gripping power. The severe pain improved around midday, and then she felt more supple as the day went on. She was swollen in her face, lower arm and leg, and felt heavy and lethargic. The pains were worst in wet weather and very much better in dry weather. She was a housewife with large family, and housework was becoming increasingly difficult. She found herself delegating more and more tasks to her family. She stopped menstruating 2 years ago. She had not suffered badly with hot flashes, but had put on about 13.5 kilograms in weight since then. She had pitting edema on her lower legs, and her face and forearms were edematous as well. She walked rather clumsy, as if her ankles were not bent. Her face was quite swollen. She weighed 95 kilograms and was 1.65 meters in height. These points were alternated with each treatment session to reduce the number of needles. So sa diagnosis, spleen damp cold, there is excess in blood, normal ang yin, deficient ang yang and qi. Spleen stores urination for the body and circulates fluid in the periphery. The patient had put on substantial amount of weight in the past 2 years, yin excess, and had edema mainly in the lower arm and legs, and her face, which is damp stagnation. These two symptoms are sufficient to make the diagnosis of damp stagnation in the spleen. The pain was generalized in many joints, so we needed to treat it as a problem of the kidney and liver. The nature of the pain was fixed, not wandering, with pains when starting to move from rest and requiring 2 to 3 hours of movement to improve. This is a damp pain because it takes a long time and more movement to circulate fluid. It is also a cool pain as it worsens during rest while in bed in the early hours of the morning. The treatment should be to eliminate and circulate dampness and warm the joints. Sa treatment, it was impossible to treat such generalized pain with local points. So general treatment for dampness was considered. Spleen 9 sedation and stomach 40. Diuretic point and Lu point, these are the best points to treat generalized dampness. They eliminate and circulate dampness. UB20 needle and capping. Back shoe point of the spleen improves function, and capping is to remove dampness from the internal organ, which is the spleen. UB58 and GB37, which is the Lu points, used to tonify yang and sedate yin in kidney and liver. REN5 and REN9 needle and capping was given only in the initial 3 sessions. REN5 is the move point of the triple wormer. This combination of points are given in general edema and are very effective. Avoid fatty and milk foods, no refined sugar or carbohydrates, less salt in order to increase urination. She was treated 3 times in the first week and then twice weekly for a further 2 weeks. Her symptoms improved within the first week down to 50%. She was much better in the 3rd week. Further treatment once monthly was given for 6 months, during which time she also lost 15 pounds in weight and was her normal self again. Next, yin and yang combined states. Sabi ng author, as I have shown you so far, the treatment of musculoskeletal pain is chosen according to the differential diagnosis made based on the answers of 3 questions. and examination procedures such as observation and palpation of pulse. A clear diagnosis leads the way to a good energy balancing treatment. When the symptoms are difficult to diagnose or the patient is not aware of their symptoms, we could end up providing poor treatment that does not give satisfactory results. But we should always try to be open-minded and find the actual imbalance of the problem. If not at the first consultation, maybe in the second or third session of treatment. The last category in musculoskeletal pain that I wish to discuss is combination of yin and yang dominant states. Generally, we should see either one in dominance, but have we not all had patients who feel pain all the time, or patients with pain during rest and during activity? What could be the imbalance in these cases? There could be two possibilities. First, both yin and yang are in excess. Number two, both yin and yang are deficient.